And a major New York City hospital is ending medical treatment for transgender youth. In a statement, NYU Langone says it's discontinuing its transgender youth health program because of the current regulatory environment. This past December, HHS cut off federal funding from hospitals that provide gender-affirming care to children, leading many to end their programs. Now, NYU Langone says it's committed to helping patients in our care manage this change. Let's bring in ABC News medical contributor, Dr. Alok Patel, for more on this. Dr. Patel, this is the first hospital to rescind gender-affirming care for minors. What's your reaction to this as a pediatrician?
The gut reaction, not only from myself, but also from my colleagues, is a little bit of frustration because once again, we have science being intermixed with politics, with federal funding being used as a leverage. And you're right, this is not the first hospital. According to a stat analysis, over 40 hospitals since the beginning of 2025 have either limited or shut down their gender-affirming care programs. But we're seeing a lot of this being driven by rhetoric. One example is major medical associations call this gender-affirming care. HHS calls it sex-rejecting procedures. So you've got this situation where we might be ending abrupt care for some families. This might widen inequity where people who can afford to go out of state or go get private out-of-pocket care will be able to, others won't. And this leads us to a place potentially for more mental health distress for kids, teens, anyone who might need this type of care.
The Trump administration claims gender-affirming care inflicts lasting physical and psychological damage on young people. The HHS secretary has called it malpractice. But some of these treatments have other uses, right? Testosterone, for example, is FDA approved to treat deficiencies, hormone deficiencies in kids. So what does the data show about the risks and benefits of these treatments?
Thank you for making this differentiation, because I think it's very important that people understand that there are cases when minors do medically need hormone therapy, such as in cases with sex hormone deficiencies, low testosterone, for example. And in these situations, there are good outcomes such as normal growth, bone, muscle growth, improved mental health symptoms as well. We do have studies that show that when children have a diagnosis of gender dysphoria and go through treatment, there are lower rates of anxiety, depression, and suicidality. But the important note here is that there are distinctions, there are diagnoses, and the children who do get those hormones are seen by a medical team for a prolonged period of time, and they're monitored. And some of the negative risks with testosterone therapy comes from adult data, such as changes in cholesterol, cardiovascular risk, and mood swings. But again, adult data.
So what's your response to critics who think doctors are going too far and they're too fast to prescribe these treatments? What is the bar to say gender dysphoria is the diagnosis, or to prescribe whether it's hormone therapy, surgery, or what have you?
If you simply look at some of the major bodies who look at these diagnostic criteria, the Endocrine Society, WPATH, the World Professional Organization for Transgender Care, these are long documents. WPATH's guidelines are over 260 pages, individualized care. Children cannot simply go into a clinic and get gender-affirming care immediately. There is months, if not years, going through involving internal medicine doctors, parents in informed consent, psychologists, and then potentially therapy. And here's the reality. When you look at surveys and people say, oh, 500, 700,000 kids identify as transgender, those are surveys. The amount that actually go and get puberty blockers, hormone therapy, or gender-affirming surgery is extremely small. In fact, one study in 2024 found that virtually no minors under the age of 12 get surgery at all. So it's very uncommon.
So what do these changes that are happening now mean for doctors who treat trans patients with gender-affirming care?
It potentially means that they might not be able to, depending on what state they're in, either because of concern for federal funding cuts to their hospitals. If you threaten a hospital to take away Medicare or Medicaid funding, you could shut down that hospital. So they will be forced to shut down these clinics. Doctors may be facing ethical dilemmas, or they can no longer care for their patients. And right now, in about 24 states, there are potential legal actions that can be taken against any doctors who perform gender-affirming care. And we just saw one report a couple of days ago. The Texas Attorney General is suing a children's hospital in Texas and a pediatrician. So there is a lot of concern right now, and concern for patients. And everybody just wants to be on the page of science and evidence-based care and leave politics out of this.
So in the medical community, what's the concern in terms of impact? What happens if you take this away?
If you take this away, there are transgender minors who want to go and seek therapy, who want to learn more about services available for them, who may not be able to. You're abruptly closing the door on many of these families, or forcing them to go out of state. There's also a much broader concern about pushing stigma against the LGBTQ community. And what that means overall, not just as it relates to gender-affirming care, but for broader medical and mental health care.
All right, Dr. Patel, thank you.
Thank you.